So I hope the numbers part of the coagulant therapeutic values did not confuse you. It just has to be committed to memory. Heparin, it's PTT or activated PTT. Coumadin, it's PTINR, and just remember those values. So for the nursing process, when you've got a patient on anticoagulants, of course, you're going to do these assessments with these blood draws. Your diagnosis, of course, is probably going to be education, because generally people aren't on anticoagulants, and once they're put on them, they're going to have to be educated about how to take the med, how to make sure that they keep getting the labs drawn, and how to be safe. So you want to tell somebody that if they're on anticoagulants for a temporary measure, they should use caution for a while after they stop anticoagulants. Maybe they've been at home on shots of Lovenox, and they only have to do that for, say, a month. So when that month is over, they want to use caution for a while after they stop that anticoagulant, at least for 2 weeks, until it can get out of their system. Remember to teach the patient and their family that the early sign of overdose, something that can be an early indication of internal bleeding, is bleeding gums. That will be an outward sign of what's going on internally. They should avoid contact sports. Don't play touch football if you're taking an anticoagulant. You ram heads with somebody, and whereas the average person would get a bump on their head, the person with anticoagulant could have subdural hematoma. Just have to really be careful. Anything where you could fall down and whack your head, not a good idea. When they're shaving, whether it's their face or their legs, they should use an electric razor. That will prevent nicks. Now, a nick can be a way of telling you that, you better call your doctor, because if you get a razor nick and the bleeding doesn't stop after 10 minutes, it's just still oozing, that tells you you're not going to bleed to death from a razor nick. But if it just keeps oozing and you still keep having to put Kleenex on it to stop it, that tells you that maybe your PTINR is just a little bit too high, and you want to call the doc and say, I cut myself 20 minutes ago and it's still oozing. Can I come in and have my PTINR checked? The heparin and the low molecular weight heparins, according to JCO, are 2 of the medications that you always check with another nurse before administering. Whether it's IV, you look at the IV bag and make sure it matches the order. If it's a heparin injection sub-Q, you're going to check it with another nurse, and then that other nurse needs to sign after you give that heparin. All right, as we talked about before with the Coumadin, and I hope you remember because it was only a few slides back, what is the antidote for Coumadin? Vitamin K for Coumadin. Anyway, sometimes somebody can also get heparin toxic. Usually after some kind of a clinical procedure, you might have so much heparin on board that the risk is still there of too much bleeding. And so it can be reversed. And the antidote for heparin toxicity or heparin poisoning is a drug called protamine sulfate. And make sure you commit that to memory, because that's a favorite question for both ATI and NCLEX. It was on my NCLEX. I still remember it. It was almost 30 years ago, but I still remember coming across that question, sitting there in that hot, overcrowded convention center in Indianapolis, taking my NCLEX with the other, umpteen thousand people who'd graduated that year. And I came to that question, what is the antidote for heparin overdose? And it was like, oh, good, I'm going to get one right. So just remember, protamine sulfate is the antidote for heparin. And I always just remembered the big P in heparin, protamine sulfate. Now, protamine sulfate is a specialized med in that it is supposed to be given by a physician, not a nurse, a physician. But we know that as nurses, we are always the one there drawing up the medication for the physician, having all the things by the physician's side that is needed to administer this injection. So what protamine sulfate is, it's a very strong protein. It's an alkaline, and when given in the presence of heparin, it counteracts it. Now, protamine sulfate itself is an anticoagulant, but it is very, very strong, and it can't be controlled, and that's why it's not given as an anticoagulant, but it does neutralize the effects of heparin. The results are instantaneous as soon as it hits that heparin in the system, and the results last for 2 hours or more. Drugs.com has a section on protamine sulfate, and you can get on there and read about it. It's used for treatment of heparin overdose, which many times takes place in the clinical setting. Maybe the person has been getting cardiac surgery, he's on heart-lung bypass. They've included heparin in the solution to keep the blood from clotting as it goes outside of the body and is circulated. And then afterwards, they need to reverse that heparin. So after a surgical procedure where heparin was used, they're sometimes going to reverse it with protamine sulfate. Protamine should only be given by a physician. Like I said, it's given IV push over about 10 minutes, so it's an extremely slow IV push. So you as the nurse are going to have to find the medication. You're going to have to draw up the correct amount. You're going to have that syringe ready for this physician when he or she is ready to reverse this protamine. Now, the adverse reactions, the person might notice their blood pressure dropping, their heart rate dropping, flushing, and a feeling of warmth. So this tells us that the protamine sulfate acts as a dilator. Along with these drops in blood pressure and bradycardia, the person getting the protamine sulfate might all of a sudden feel very exhausted, very fatigued, and might have some difficulty breathing as they sense that, big drop in blood pressure and heart rate. And that's normal. You can reassure the patient it's normal. You're going to stay by their side. You're going to be checking their vitals. You're going to be reassuring them, maybe put some oxygen on, elevate the head of the bed so that it's easier for them to breathe, and you can just kind of reassure them that that's all normal and that will pass. Protamine sulfate does not interact well with many antibiotics, and the examples I've seen are penicillins and cephalosporins, but I think other antibiotics don't mix well either. So if the person is getting an antibiotic, it might have to be stopped while the protamine sulfate is being infused.